Welcome to the Richmond News MLA Roundtable. We're pleased to have with us here Teresa Watt, BC United MLA for Richmond North Centre, Henry Yao, NDP MLA for Richmond South Centre, and Kelly Green MLA for Richmond Steveston. To start, let's hear a few words from our MLAs. Henry, if you would like to start introducing yourself, and we can go forward.
Well, I guess thank you so much for the opportunity. I want to say hi to our Richmond News audience, and I'd love to take this opportunity to introduce myself. My name is Henry Yao. I'm MLA of Richmond South Centre. This is my first term, and I've been very grateful to have been given this privilege to serve and being able to attend all different events, stay engaged with the community, and really try and find a way to help our voices in Richmond to be heard at the provincial level, and to ensure we find strategies and policy to really support the prosperity and growth of all British Columbia.
Hello, my name is Teresa Watt. I'm the MLA for Richmond North Centre. This is my third term as an MLA, and I'm seeking the fourth term to continue to represent the interests and the voices of all the Richmond residents, and also promote the inclusivity and prosperity of British Columbia, in particular Richmond. So I am grateful to BC. In 1989, I've been here for more than 35 years, and I have been working in different media, including radio, TV, and newspaper, as well as reporter, editor, and news director, and also CEO. So I also work in the British Columbia provincial government in different capacity. The last job was as a director of multiculturalism ministry. And before I joined politics, I was a CEO of a multicultural broadcasting station for 10 years, almost 10 years. And I was also the news director for the multicultural first news program in British Columbia. And we have Punjabi news, Cantonese news, Mandarin news, Tagalog, and also Korean. And I am so happy to meet all the Richmond News audience. Thank you.
And I'm Kelly Green. I'm the MLA for Richmond Steveston, also Parliamentary Secretary for Fisheries and Aquaculture. I'm lucky enough to have been born here and raising my family here, which is such a privilege. It's a beautiful community, and it is such an honor to do the work of supporting everybody, making sure that we're getting the investments and services that we need in our community. And that's what gets me up every day, the opportunity to serve.
Thank you so much. And being an MLA doesn't brush aside the fact that you have all had personal challenges and goals along the way to your roles. Kelly, before you were elected as an MLA in 2020, you were a Richmond City Councillor. What was the transition like moving from municipal politics to provincial politics?
It was really interesting in that the skills and systems that I learned at the city were really applicable to the province. The province is always looking for good partnerships, people that are ready to deliver programs and services, and the City of Richmond is one of those really great partners. So being able to understand how provincial work intersects with municipal work has made me much more effective in finding opportunities to make our community better.
And Henry, finding a good work-home balance can be challenging at times. You had a baby during this term. So Two babies, sorry, apologies. How do you maintain a balance between taking care of a young family with your job as an MLA?
I think for starter, I think we need to acknowledge the fact that being an MLA is a position privilege. We have more resources than typical British Columbian, and we have more support. I'm also very thankful that my father and my mother, and of course my wife's parents, are also been very supportive, and they've been doing their best to help us manage the childcare needs, as me and my wife are trying our best to navigate through our political and our career ambition. I know Teresa Watt and I bump into each other quite often at different events. We often joke about her grandkids and my kids, and how it is definitely hard, but it's a huge reminder for all of us that while we're working so hard for British Columbia, we're not just simply building a brighter future for ourselves, but we're also building a brighter future for our kids as well. I know for the last 3 years I've been working really hard, usually about 70 to 80 hours a week. I've been attending, I think the maximum event I attended a day actually 16. So my wife made sure that she had a fortunate talk with me to ensure that for me to run for another election to become serving British Columbians, I must promise her I need at least keep 1 day off per week, so that way I can spend some more time with the family, and try my best to, arrive home before 8:30. I think Teresa White knows very well. I try to rush out as soon as it's 8:30, so I can be home to be with my kids and go through a nighttime routine with my kids to ensure that we spend our time looking after our loved ones, and not just simply spending energy on policy, legislature, laying the foundation for a brighter future, but we also spend time holding our kids, be reminded why we're doing all this great work for our family and for our neighbors and for our community.
Mm-hmm. And Teresa, during this term, you were able to push through legislation recognizing a day of Buddhism. What did it mean to you to have this day declared?
I was fortunate enough to be the Minister of Multiculturalism from 2013 to 2017, in addition to my portfolio as a Minister of International Trade and also responsible for Asia-Pacific strategy. Since then, I've been talking to people of different ethnicity, different religion, and in Richmond, there's a Highway to Heaven, and number 5 road, there are many Buddhist temples, not only in Highway to Heaven, but also in other areas, in Steveston, in my riding as well. So a lot of Buddhists and monks and nuns, plus many Buddhist followers, and even non-Buddhists, expressed to me that the BC provincial government do recognize and celebrate many other festivals or religions. For example, the Ismaili events, the Jewish Heritage Month, and also Holocaust, and also Diwali, and Wasaki, we just held Wasaki, and also different other ethnicity, the Iranian culture. So they said that it will be good for the general British Columbian to understand about Buddhism and to understand the Buddhist culture, because in BC, 90,000 people self-identify themselves as Buddhists. Some have not even identified themselves. And that's why, because I have been hearing this for so many years, I decided that I started a petition on the website trying to get not only Buddhists but non-Buddhists to see how they respond to the recognition of Buddhist culture day, so that more British Columbia understand the Buddhist culture. And I'm glad that many Buddhist temples and Buddhist followers and also non-Buddhist British Columbia supported, and I have solicited more than 10,000 signatures, and I managed to have 2 major events for the first time in the Hall of Honor, to have Buddhist Dharma blessing and also Buddhist performances, and all the Buddhists, many monks and nuns wearing their robes, sitting in the public area for the first time ever in the history of BC. And I presented also a private member bill and to urge the government to recognize the first Sunday of May every year as Buddhist Culture Day. And I'm thankful to the BC provincial government for recognizing the Buddhist Culture Day. So this year it will be May 5th. I hope that everybody can go and attend all the celebration in Richmond.
And speaking of challenges, one of the most challenging issues for people living in Richmond, especially young people, is the cost of housing for both buying and renting a home. And this is not something that has happened overnight. It's been happening for years, and home prices have been rising. Kelly, your government has introduced some measures such as densifying single-family neighborhoods, allowing more housing near transit, and regulating short-term rentals, which is prolific in Richmond. But this seems too little too late. How do you think this will help in the housing crisis we are currently in?
I think it's going to take a lot of different aspects of policy to get the momentum that we need in housing. As you said, it's been a long time coming, and complex issues don't have simple solutions, and that's just the reality of life. And so we've taken a number of measures, some of that you've mentioned, also empty homes tax, which brought another 20,000 units back to market. But we're also partnering with municipalities and nonprofits to bring more affordable housing faster through BC Builds. And we're also looking at BC housing land for additional densification opportunities wherever possible. For example, Rosewood Village, which is going to bring over 800 units of more affordable housing at a variety of affordable housing bands to market. So it's going to take a lot of work. It is going to require partnerships. The City of Richmond has been an excellent partner in bringing housing to market. For example, the new Pathways Clubhouse rental housing for people who have mental disability or illness. And so when we're supporting people across the housing spectrum, we're all going to be better off for it. And there's always more to come, and we are working hard on that.
Thank you. And Teresa, this housing crisis started when you were in government. If elected, what will a BC United Party do differently to help people find homes?
Since this government was in power in 2017, we have seen that we have the highest rental in Canada. We are the most unaffordable province in the whole of North America. And that's why we think that better is possible, and the current policy and whatever measure that have been introduced are not working. That's why BC United, under the leadership of Kevin Falcon, we already announced the major 4-point housing platform in order to especially help first-time buyers so that they can have their home. So we are going to introduce a rent-to-own program, which means that the first-time buyers, they can rent a home and pay the rent for 3 years. And at the end of 3 years, all the rental they pay for will go to their down payment. And that will really help them be able to own their first home. And the second platform that we have on the housing issue is we are going to eliminate the property transfer tax for first-time buyers for buying houses less than $1 million. That will mean that they will save $18,000. So that will again help first-time buyers, young people, to be able to get into the housing market. The third platform that we have is we are going to eliminate provincial tax for developers who are going to build residential building, because right now all the houses are the prices are so high that are unaffordable to the general public. By eliminating the provincial tax for developers developing residential housing, that will be able to lower the prices of housing. The fourth platform that we have, the major platform, is we are going to lease the unused public land, crown land, to developers at a token amount of $1 for 99 years for those that are going to develop housing for seniors and for families who cannot afford the current market prices housing.
So there are almost 1 million British Columbians without a family doctor, and in Richmond this number is estimated to be about 40,000 residents. Furthermore, emergency rooms are consistently overcrowded. Kelly, most solutions the NDP government is working on, like training more doctors and rebuilding the Richmond Hospital, are long-term solutions. Like the housing crisis, what immediate or short-term solutions does your government have to get people the medical help they need today?
Thanks so much. I know how important it is to get healthcare when you need it. I've got little kids, they have accidents and you need to go get help. And I've got parents who are on the older side of things, and how important having that longitudinal care is. We have hired over 700 net new doctors. The new family practitioner health compensation has been very attractive for people in family health. And so we're getting a lot more family doctors. We're also working on foreign credentialing. So for folks who are trained overseas in high quality educational programs, we want them to be able to work here. And so we're reducing those barriers, making sure that they can enter our healthcare system. We're also hiring across the board, whether it's nurse practitioners, technologists, all kinds of support staff that are required in the health professionals. We've also opened 2 urgent and primary care centers in Richmond, which are really great. They can triage medical problems that are not as urgent as an emergency room visit, but still you really can't wait to go see a doctor or wait in a clinic. Things like a bad UTI or a really bad sprain, or I went for stitches once, so they're a really great resource. And then also making sure that people can get healthcare in different ways. So we have 21 minor ailments that can be seen by a pharmacist. So things like rashes or pink eye, they can be seen by your pharmacist as well. Really taking the burden off of the medical system is free contraceptives. So having access to contraceptives through your pharmacist is really reducing that barrier to access healthcare, as well as making it really affordable. So there is obviously more to do. As you said, there's a lot of long-term plans. The redevelopment of Richmond Hospital is already underway, but we are working really hard on our HR strategy for health, and we are seeing results. It's going to take time to recruit lots of more family doctors, but we have seen a significant reduction in the number of people who are not attached to family doctors. We are seeing progress, and we're going to keep up the good work.
And Teresa, if elected, what will a BC United Party do differently?
I think it's very clear since this government was in power in 2017, everything, of course including health, is going downhill. When BC Liberal, now is called BC United, when we were in government in the 16 years from 2001 to 2017, we had the best cancer health care in the country. And now, our cancer health care is just I don't have to say, everybody knows it, that we have to send cancer patients to the United States across the border. And yet, the promised number of patients that are going to be sent to the USA is not the number that the health minister has promised. Only 20% of those that have been told that they will go down to the state to a cancer treatment got it. The rest have to wait, and many have to spend their own money to go down to the state or go to Asia to get cancer treatment. So this is what's wrong with this government. It's all talk, and it's all expanding the bureaucracy. We have the most number of VP in the Ministry of Health, and they are being paid over $300,000. And by spending money without outcome is not the way to go. And 1 in 5 British Columbian doesn't have family doctor. And we have the longest waiting time for walk-in clinics. And 1 million people, 1 million British Columbia cannot see their specialist. So you can see all the problems there. I think it's time to change all the policy. It's the minister, it's the people that know how to manage. And that's why we have to change the whole system. We have been spending more and more money into the health ministry, and yet the outcome is getting worse and worse.
If you don't mind, I'm going to piggyback a bit of information because some information provided was incorrect, inaccurate in regard to the healthcare issue. In February 2024, the Doctor of BC came out with an article and made this very clear that even though I know it's still an issue that needs to be addressed, we went from 1 million people struggling not be able to have family doctor, went down to 700,000. The number is not pleasing, of course, but it is a progress that can be able to see statistically. I think another thing we also need to understand, BC population has been growing, and despite the growth, we are reducing the number of people who may need for family doctors.